Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Health Adviser. Welcome, Dr. Raja.
Thank you, Madison. Happy to be here.
Our topic today is the new COVID-19 variant. Dr. Raja, what is the new variant?
So the new variant is called the E5, G5 variant, and it is a variant that has descended from the Omicron variant that showed up a few years ago.
So what are the new symptoms? Is there any different from previous strands?
Sure. So the new strain, since it is a variant of the Omicron strain, the symptoms are pretty similar to what someone would have if they got the Omicron strain of of SARS-CoV-2. So the symptoms, as we know right now, are pretty mild. They would, in an average healthy individual, be very similar to cold-like symptoms, maybe a bit of a scratchy throat, and fairly similar to what we've been seeing.
So with that being said, how worrisome is this new variant?
So given that the variant, it is a variant, it is slightly different from the past Omicron strains, it is still considered as something that's going to look a little different. And therefore, if there are people who have been vaccinated against SARS-CoV-2 or COVID-19, but say they only got the very initial vaccine and didn't get any boosters, then they are likely not as protected as someone who stayed up on their boosters. And currently, that doesn't mean you cannot get the booster and you will not be protected. Even if you've had the last booster, there is still some protection, but that protection is likely going to wane just simply because of how that vaccine was designed. And so currently, we're waiting for the new boosters that are supposed to show up, I think, mid to late September. And those boosters, even though they aren't very specifically designed for this E5 variant, they have done studies with them and they show that they will protect against the new variant as well.
So what is the policy at NSU for students, staff, and faculty?
So currently, from what we know or what has been posted on NSU's webpage is NSU follows CDC's guidelines in terms of vaccination, in terms of how you protect yourself, and if you do end up getting COVID-19, what are the precautions you should be taking. So if someone is unwell or has symptoms right off the bat, then you should not be showing up to your place of work or should not be showing up to your classroom. You should quarantine yourself for sure if you're showing signs and symptoms of the disease. But if you feel like, oh, I may have been exposed to the virus, but you really don't have symptoms yourself, then the best thing one can do is to put on a mask, especially if you're going to be in a public place. But ideally, you should quarantine yourself so that you don't spread the virus around. And NSU's policy, like I said, mirrors whatever CDC's policy is, which is basically if you are showing signs or symptoms, you should quarantine. You must get yourself tested at least 5 days post that exposure to determine if you're still showing up as being positive or negative for the virus.
So for example, at the beginning of this semester, a student's roommate had COVID, and they asked their professor if they should come to class, and their professor told them not to come unless they tested negative. Was that the correct approach?
So that is the safest approach, I would say. So obviously things are changing constantly, so there should always be an update in terms of how best we should prepare. But basic idea is if you've been around someone who has tested positive, the safest thing for you to do would be to keep yourself masked and away from public spaces and get yourself tested as well. Now, if you get yourself tested and you show up positive, then yes, you absolutely cannot be showing up to class and being in a public place. But if you get yourself tested and you are negative, then you're good to go to move around. But if you want to protect yourself from your roommate, for example, whom you know has the virus and is harboring the virus, then being masked up and getting yourself regularly tested would be a smart thing to do.
Thank you for clarifying. Do you have any last thoughts?
Again, my last thoughts, the basic idea would be to follow up on what NSU's policy is. NSU does have a webpage dedicated to COVID-19 policies. All students should kind of follow up on that and stay updated with that page. And they do keep updating that page as new variants show up or new vaccines show up. NSU, it lists out very clearly what you should do, where you can get tested, where you can go to get a vaccine, what you should do if you reside in a dorm versus if you're at home and driving into the campus. So it lists out very clearly. So I would encourage everyone to look up the website and our COVID-19 policies.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.